Right now, as you're watching this video, nearly 3 billion people around the world are dealing with some form of headache. That's almost 1 in every 3 people on this planet. But here's what most people don't realize. Not all headaches are the same, and treating them the wrong way could actually make things worse. In the next few minutes, I'm going to show you the 5 most common types of headaches, the latest science behind them, and exactly what you should do about each one. Stick around till the end, because I'll reveal the #1 mistake people make that turns a simple headache into a chronic problem. According to the latest 2025 research published in the Lancet Neurology, headache disorders now rank as the 6th leading cause of disability worldwide. That's massive. And what's even more concerning is that studies show over 50% of headaches are either misdiagnosed or improperly treated. So let's break down the science and help you understand what's really going on inside your head. Type 1. Tension-type headache. This is by far the most common, affecting anywhere from 46% to a staggering 78% of adults, according to recent medical data. So what does it feel like? Imagine someone wrapped a tight elastic band around your forehead and just kept squeezing. That's the hallmark sign. You'll typically feel a dull, constant pressure on both sides of your head. Not pounding, not throbbing, just constant pressure. The pain often feels like it's radiating from your neck or shoulders up into your head. Here's the latest science. Researchers have found that these headaches aren't actually caused by muscle tension alone, like we used to think. Instead, it's a combination of muscle tightness and changes in pain processing in your brain. This is why stress is such a huge trigger. It affects both your muscles and your nervous system. What causes them? The big ones are chronic stress, poor posture, especially from looking down at your phone or computer all day, lack of sleep, dehydration, and eye strain. Quick solution. For occasional tension headaches, over-the-counter pain relievers work fine. But here's the key. Don't rely on them too much. The real fix? Address the root cause. Take breaks from screens every 20 minutes. Stretch your neck and shoulders, stay hydrated, and manage your stress through exercise or meditation. Studies show that regular physical activity can reduce tension headache frequency by up to 40%. Type 2. Migraine. The headache that can completely derail your entire day. According to the latest Global Burden of Disease study from 2025, migraines affect about 14 to 15% of the global population. But here's the shocking part. Even though they're less common than tension headaches, migraines account for 90% of all headache-related disability. That's how intense they are. A migraine isn't just a bad headache. It's a complex neurological condition. Here's what makes it different. Migraines typically cause severe throbbing or pulsating pain, usually on one side of your head, but goes beyond pain. You might experience nausea, extreme sensitivity to light and sound, visual disturbances like seeing flashing lights or zigzag patterns, that's called an aura, and in severe cases, difficulty speaking or temporary vision loss. The latest 2025 research has revealed something fascinating. Migraines involve abnormal glutamate activity in the brain. Glutamate is a chemical messenger that helps brain cells communicate, but in migraine sufferers, it can trigger these debilitating attacks. This discovery is leading to breakthrough treatments that we never had before. Migraines progress through 4 stages. First, the prodrome phase, where you might feel irritable or tired a day or 2 before. Second, the aura phase with visual or sensory disturbances. Third, the attack phase with intense pain lasting 4 to 72 hours. And finally, the postdrome or migraine hangover, where you feel drained and foggy. What should you do? If you're experiencing migraines, you absolutely need to see a doctor. New treatments like CGRP inhibitors have revolutionized migraine care and can reduce attack frequency by 50% or more. Also, identify your triggers. Common ones include certain foods, hormonal changes, lack of sleep, and stress. Keeping a headache diary can be invaluable. Type 3. Cluster headache. Cluster headaches are often called the worst pain known to medicine, and for good reason. Thankfully, they're rare, affecting less than 1% of the population, but if you have them, they're unforgettable. Here's what sets them apart. Cluster headaches cause sudden, severe stabbing or burning pain around or behind one eye. The pain is so intense that people often can't sit still. They pace, they rock back and forth. And unlike migraines where you want to lie down in a dark room, cluster headache sufferers often feel restless and agitated. These headaches come in clusters, hence the name. You might get them at the same time every day, often waking you up in the middle of the night. Each attack lasts 15 minutes to 3 hours, and you might have 1 to 8 attacks per day during a cluster period, which can last weeks or months. Other symptoms include redness and watering of the eye on the affected side, a drooping eyelid, nasal congestion, and facial sweating, all on one side of your face. Recent research suggests these are linked to disruptions in your body's biological clock, the hypothalamus specifically. What to do? Cluster headaches require specialized medical treatment. Oxygen therapy is the most effective immediate treatment, and preventive medications can reduce the frequency of attacks. Don't try to tough these out. Get professional help immediately. Type 4. Sinus headache. Sinus headaches are often confused with migraines, but they're actually quite different. These occur when your sinuses, the air-filled spaces in your forehead, cheeks, and around your eyes, become inflamed, usually due to infection or allergies. The telltale signs: you'll feel deep, constant pressure and pain in your forehead, around your eyes, or in your cheekbones. The pain typically gets worse when you bend forward or lie down. You might also have a stuffy or runny nose, facial swelling, and sometimes a fever if it's an infection. Here's the critical point. True sinus headaches are actually less common than people think. Studies show that about 90% of people who self-diagnose sinus headaches actually have migraines. The giveaway? True sinus headaches are accompanied by thick, discolored nasal discharge and often follow a cold or during allergy season. What to do? If it's allergy-related, antihistamines can help. For infections, you might need antibiotics prescribed by a doctor. Home remedies like steam inhalation, warm compresses on your face, and staying hydrated can provide relief. But if symptoms persist beyond 10 days or worsen, see a healthcare provider. You might have a bacterial infection that needs treatment. Type 5. Rebound headache. Here's the headache that nobody talks about, but everyone needs to know. The medication overuse headache, also called a rebound headache. This is the ironic headache you get from treating headaches. Here's how it happens. When you take pain medication too frequently, we're talking more than 2 to 3 times a week for over a couple of weeks, your brain starts to adapt. When the medication wears off, you get a headache, so you take more medication, which leads to more headaches. It's a vicious cycle. According to 2025 global health data, medication overuse headaches account for over 20% of all headache-related disability. That's huge. For people with migraines, medication overuse makes up 22.6% of their disability in men and 14.1% in women. These headaches feel like a dull, constant ache, similar to tension headaches, but they're there almost every day. The pain is typically worse in the morning and might improve slightly after taking medication, only to return later. The solution? This is tough, but necessary. You need to stop the overuse under medical supervision. Your doctor might recommend a medication holiday, where you gradually reduce or stop the medication while managing withdrawal headaches with other strategies. Prevention is key here. Don't take pain medication more than 2 days a week if you can help it. Warning signs and when to see a doctor. Now, before we wrap up, let's talk about red flags, warning signs that your headache needs immediate medical attention. Seek emergency care if you experience a sudden, severe headache that feels like a thunderclap, the worst headache of your life. A headache with fever, stiff neck, confusion, vision changes, difficulty speaking, numbness or weakness. A headache after a head injury. Or a completely new type of headache if you're over 50. Also see a doctor if you're having headaches more than twice a week, if over-the-counter medications aren't helping, or if your headaches are interfering with your daily life. Conclusion. So there you have it, the 5 most common types of headaches and what you need to know about each one. Remember, the key is identifying which type you're dealing with so you can treat it properly. The biggest mistake people make? Self-medicating too frequently which can lead to those medication overuse headaches we talked about. Here's my challenge for you. If you get headaches regularly, start keeping a headache diary this week. Track when they happen, what you were doing, what you ate, your stress levels, and how you treated them. This information is gold for both you and your doctor. If you found this helpful, smash that like button and subscribe for more health content backed by the latest science. Drop a comment below and let me know, which type of headache do you deal with most often? I read every comment and I'd love to hear your story. Until next time, take care of your head and I'll see you in the next video.